We're about to jump into the exercise with Dr. Sherri Betz. We're very, very excited about this. Okay, so take it away.
Okay, perfect. All right, so the first thing you'll need is a broomstick. So let's get a broomstick, and it's always great if you can back up from the camera at least 8 to 10 feet. And I know that if you're not used to exercising on Zoom, you might have to figure out how to set that up. So let me get my dowel. And I'm going to turn on a little bit of extra light here. I don't like to sit with that light blaring in my face, but when I'm far away from the camera, it's better. Okay, so we're going to place the dowel on our back and put your head, mid-back, and sacrum against the dowel. Okay, now if there's anybody out there that feels like they can't reach the dowel because they have some roundness in the upper back, it's always okay to just hold it with one hand down below and just let it touch 2 points. Now you do have to be a little bit more mindful about your head coming forward when you bend forward. So what we're going to try to do is see if we can march in place with the dowel on the back. That's the first thing, is that sometimes when we lift one leg to march, it's like this will happen. Your tailbone and the dowel will come off your tailbone. So we're going to lift and see if we can march in place. And I'm going to just turn sideways so I can see you. And I want to take a look at how you guys are doing. Everybody I can see so far looks really good. I'm going to look at the second page here because I can always see. Yes, that looks great. Yeah, Sandy, that looks good. Nice, Linda. Yes. And Dawn, I think you need to tilt your camera down and step further away from the camera. Yes. Okay. Excellent. Okay. Now our next event is to separate our feet about shoulder width apart. And then I want you to see if you can hinge at the hip joint without the tailbone coming off of the stick. Okay, got some people that need to mute. Okay, we did. And so you're doing, it's not really a bow, right? It's more of a squat. And I want to see that everybody can do that. That's the first thing you need to do. Way to go, John. I love that. He's helping her. That's good. Yes, Amanda, that looks great. Carla, great. Carol, wonderful. All right, Sharon, it looks like you have like a vacuum cleaner back there. I'm not sure what she's using. Oh, that's great. It's got a little tilt forward. And then Peggy, if you can tilt your camera down some. Nancy, I love it. You got the broom, and Kathy's got the mop. Irma, that looks great. Yes, Darcy, I love that. Rose, can you tilt your camera down? Kristen, that looks good. All right, I think we're good. I don't see anybody doing it incorrectly. If there's anybody specifically that wants to be seen, just wave your arm. Let me know. Okay, I think everybody's looking good. Nancy, watch out that you don't go too far forward and let the broomstick come off your tailbone. Okay, so now what we want to do is, I think some of you are already doing that. You want to see if you can touch the floor so that we can pick up something off the floor without compromising our back. So if I put the dowel on my spine model here, it's exactly what you're doing here. Yes, and you're trying to maintain that spine elongation and that neutral orientation as you lift. Amanda, that looks good. And then Nancy, you hold the stick to your back and then do the touch. What this also does is it gives you a great warm up. So the camera is on John. It says John, but I bet you're not John. In the purple shirt, please stop. Okay, yes, stand up tall. In the purple shirt, yes, thank you. There you go. Can you hold the stick against your head? So it's what you're doing now is rounding your back to get there, and that would not be safe for you to do. So yeah, see if you can hold the stick against your head And then I want you to turn your hand palm facing your back and your thumb in between the stick and your low back. And that way you can push the stick into your back, and you want to feel it against your head and your tailbone especially. So try that. Now squat a little bit. Let's do a tiny little squat. Yeah, that's much better. That's much better. I think that's better. Darcy, that looks great. Lucilla, good. Yes. All right. I think everybody else is looking good. There you go. Another thing you can do if you feel like you need more practice is to sit in a chair and then do a little hip hinge in the chair so that you're not kind of focusing on your balance as much, that you can just kind of feel the 3 points of contact. And every time you stand up to do something, you are in the right alignment. And then be sure that you're not using a chair with wheels, because I know a lot of you have desk chairs by your computer, so you don't want to use that to practice, because I don't really want you to roll out, have that chair roll out in front of you. Okay, so we're ready for the box now. I like using a file box. And the file box, this is a 12-inch by 12 inches, maybe 11.5 by 11.5. And then I've got all kinds of things in here. But what I do sometimes is I just weigh it and see how much is in here. And right now I have about 10 pounds in this box. So I'm not suggesting that you put 10 pounds. If you've never done strength training before, you're just going to start with 1 pound and put it in the box. Okay. If you want to just use nothing, that's fine too. Okay. If you have a box with handles, what's really great is to hold on to the handles and then draw your shoulders back. So I'm going to get closer so you can see what I'm doing. I got my elbows straight. My body is parallel to the floor. And then I'm just going to do a shoulder retraction like that. So I'm not going up by my ears, right? I'm pulling back like that. Okay. And then that's going to be the first thing that you do. You pull those shoulders back, you take a breath in, and then you stand straight up and just let the box rest against your leg. And then you hinge, touch the box to the floor, and back up. Okay? And let's see how everybody's doing with that. Okay? And the one that has John on the camera, I don't know what her name is, but stand up tall. And so it's not this, right, that you're lifting the box like this. It is a shoulder movement, shoulder blade movement. And you're just going to stand up tall and let the box rest against your body. And then you put the box down. So if you can bend your arms with the box, then the box is way too light. So that's one of the ways that you know that your box is too light. It's not going to have the effect on your back that you want. Yeah, and Jennifer, go ahead and stand all the way up. That looks good. Yes, there you go. Each time, this is your victory lap. You stand up tall, let that box have its magic load through your spine, and then you touch the box to the floor and then put it back. And then come back up, touch, and lift. Okay? And now, if you have the hip mobility to be able to get down and reach underneath the box. So this is where we get into function. Like, can you pick up a package off your front doorstep? Pull the shoulders back, stand up tall, and then you touch the box to the floor. Now it's going to feel heavier, even though it's not heavier. It feels heavier because you've got to bend lower to get the box to the floor. Okay, so let's see how everybody's doing with that. And you want to put the box right between your feet. Not in front of your feet, but right between. So I am straddling the box so that my feet are right on the edge of the box. And you'll understand why if you pick up a barbell, your feet are underneath the barbell. Okay? There you go. And you want your feet wide. The box should go between your feet. Let's see, Darcy, you got it. Yes, that looks good. And Peggy, your laundry basket is way too wide. So you got to be careful. Yeah. Just to know. Amanda, that looks like a perfect size box. Carla's got a banker's box. That looks good. Kristen's box might be a little bit too wide if you're going to put a lot of weight in it. Yeah, that's why it's really important that you have the right size box. And keep your shoulders pulled back, your chest lifted. Okay, so this is what happens now. So you've got the technique, and now you're going to start adding weight. You add a pound, you try to do 15 reps. So every time you work out, you try to do 15 reps. If you can't do 15 reps and you can do 8 or 10, so I always say you got to make it to 8, and 15 is your trigger to go up on the weight. Okay, so at least 8 and then maximum 15. So when you hit 15, that's when you know, okay, I'm going to put another pound in my box, right? Everybody good with that? Okay, so that's how you're going to go up. Now I'm going to demonstrate just for a moment the barbell lift. Now most people are afraid of the barbell. So if you haven't done strength training before, almost every one of my patients and every one of my students is afraid of the barbell. But once you start realizing how much nicer it is to hold the barbell with the circular, grip, it's actually much more comfortable. Okay, so when you lift a barbell, it's up off the ground because you have plates on there. And the barbell that I recommend is a 25-pound barbell that you can actually prop up onto books or yoga blocks so that it's elevated off the ground if you need to. And you don't have to put any weight on it at first. So you've got to get to the point in your box that you can lift, say, 30, 35, or 40 pounds. And then you know that you're ready for the barbell. So you don't have to get the barbell until you get ready for that, until you can do 30 to 40 pound lift in your box. And that's like mulch, soil. If you're a gardener, can you pick up dog food? If you have a large dog and you get big bags of dog food, those kind of things weigh usually that much. So, all right. So toes are underneath the bar. My feet are a little wider than shoulder width. I'm going to grip right above my toes, lift the chest. I'm going to pull those shoulders back just like I recommended. Breathe in, breathe out, stand straight up, and just let the bar rest against my leg. So that is what we call a deadlift. We hinge at the hip. The bar goes straight down in front of my knees. I don't have to maneuver it around my knees. So I'm going to turn to the side so you can see. Wide stance, touch, and lift. Touch and lift. So you see my shins are pretty much vertical. The bar goes right in front of my knees. I don't round my back. My back is not compromised. Okay? So again, there's not many of you that probably have a barbell, but that would be the way you would do it if you did have one. And if you need guidance on how to progress with that, certainly can help you with that. Okay, our next exercise, going to use the dowel. And next exercise is going to be the overhead press. It's a good one to follow with the deadlift because it doesn't use any of the same muscles, right? So you can pull the dowel to your chest, elbows down, standing tall, and then just press the bar overhead. Now, if anybody has shoulder pain with this, I have a little routine that you can do that will help you with centering your shoulder in the socket and reducing the impingement if you have that. Okay, then you're going to take the bar and bring it to the top of the head. Pull the elbows wide. Make it down just a little bit so you can see. Like that. And then for mobility, see if you can get the bar behind your head. You're not going to use weight with it, but you're just going to work on your mobility. And so that's something that you can do for the next few days or weeks before you start adding resistance. Okay? So now what I want you to do is just remember that you want to be wider is friendlier to the shoulders. Narrow is tough on the shoulders. So that wider grip is better for your shoulders. So sometimes just separating your hands is helpful. And the idea of pulling apart on the bar, so it's like you're trying to pull apart, you'll engage these muscles here, and then the shoulder will drop into the socket a little bit better. And sometimes that can help if you have pain. Okay, now how do we start adding resistance with that? So some people will just say, oh, let's pick up some dumbbells, which you certainly can. But my favorite way is to get a TheraBand, a long TheraBand, and tie a slip knot in it. If you don't have one, you don't have to do that right now. But You'll need it to be pretty long. I'm 5 feet tall. This TheraBand is about 6 feet long because I have made a slip knot, so that takes up a lot of the inches at the end. So I'm going to slide it on my bar, sorry. And then I'm going to get my other one. So this isn't even the same color, right? This is blue and green in the TheraBand brand. I've done the same thing here. I have a 6-foot band and I've put a slip knot in the end. So it's really easy to take on and off. Now, these aren't the same tension, but they're going to feel the same once I get it up there. So I'm going to stand on the bands, crisscross them over, and I'm going to make the green one just a little tighter than the blue one. So the bar is going to look uneven at first. So if I just lifted it up with my fingers, it's a little bit uneven. I'm going to get the bands centered, holding wide. I'm going to pull the bar to my chest. And then let's see if that feels okay to push overhead. Then the bar goes to the chest and I press overhead. And so that gives me that really nice resistance. Now, if you feel like it's too much, then you can just separate the bands a little bit more. And then the tension doesn't start as soon. It's a lot lighter. I find that the yellow and the red band from the TheraBand brand are quite light. So they might break. If you stretch those bands too much, sometimes they break. And you're pretty strong in this motion. So I'm thinking that the green or the blue is a better place to start. Okay. And then you can start tightening it up as you get stronger. Once you can do 15 in a row, time to go to the next resistance point. And that just means to crisscross them over at some point. Now, at a certain point, this is going to get too light for you. You'll do 3 sets of 10, but remember that you're always trying to go to 15 so that you know when to go up on the resistance. And then the next little tool I can share with you that's really nice is a weighted bar. So that doesn't take up a lot of space. Some people like to use that in lieu of a barbell. And then this is an 8-pound weighted bar. And you can do the same thing with that. And it's interesting, a bar is easier on the shoulder than dumbbell. Because with dumbbells, you're going to have to use your deltoid muscles a lot more. And that tends to pinch the shoulder a little bit more. So that's what I usually recommend for people that have shoulder pain. Now, this bar comes with some tubing that can add resistance. So here are the tubes. And I'm going to stand on them just the same way I did with the other bar. And then press overhead. So this provides a good bit more resistance than the wooden dowel because the tubing is thicker and the bar weighs 8 pounds. So this is a good segue if you're not ready for the barbell yet. And so I'm always ready for that barbell. Okay, so then the next event is how to lift your barbell overhead if you have one, right? This is what you're going for. I'm going to get back behind it. I'm going to bend my knees, place my hands wide, and then stand up with the bar against my chest. So as you see here, I've got the bar right across my chest under my collarbone. I'm going to breathe in and breathe out to push it overhead. Now, as you can see, I'm struggling a little bit more with this one, but that's kind of where you want to get to eventually is you want it to be pretty hard, right? If it feels easy after you've done that 8th rep, then it's too light to have the effect on your spine that you want. Because remember, we're not necessarily trying to build shoulder strength. We want this position right here so we can load that spine and then take it up. And you can see that my spine is staying in alignment. I'm not arching and I'm not rounding. I'm trying to stay vertical. And then once I've done my reps, I'm going to take it back to the rack and put it away. So you can pick it up from the floor, but you do have to get it from here to here and then put it overhead. You don't necessarily need the rack for that exercise. Okay, so do we have time for one more exercise? Okay, so the third exercise in the strength training program that I teach is the back squat. Now, with the back squat, you need a backpack if you don't have a barbell, because with the back squat, you have to have the weight on your back. So it doesn't make any sense to have the weight in the front because you just did that with the deadlift. So you're trying to get the weight on your back. So I think the backpack simulates that the best. So I have this North Face old hiking day pack, and I have some weight plates in here that I've put in here. And you would start with whatever you can handle. So maybe 5 pounds, maybe it's just 1 or 2 pounds. I cushion it with pillows so the weights don't jangle around in there. I want it to be firm and steady. I don't want the weights to fall around. And I can put water bottles, soup cans in there. And here's the thing. If I try to put this on with a lot of weight in it, I'm going to end up like torquing my back to try to put it on. So what I suggest is that you either load it up on your kitchen counter and you take it, bear hug it, bring it over to your kitchen counter, which mine is over here. And I'm going to place it on the kitchen counter. And I apologize if it's dark in here. Turn my back to it, put it on so that it's supported while I'm putting it on my back. And I'll get to my back and then step away. Now it's on my back. I didn't twist my back. I didn't hurt myself trying to get it on. And then the next thing you'll need is either a standard chair or a stool. So I have this little stool right here. I'm going to put it here on the mat. And then I'm going to add a bar to my back, just the wooden dowel, so that I'm in the position that I'm going to be in eventually with a barbell. Okay. So I'm here like this, and I'm going to sit, touch my butt to the stool, and stand back up. And I'm trying with this version to be as vertical as possible in the trunk. You will tilt forward, and that is normal. But we already did the deadlift where our trunk went to parallel. So we're going to feel most of this in our legs. And then if you have a coffee table or, something sturdy that you can touch your bottom to and then stand up, even if it's like a sofa and you just touch and lift, what you're trying to do is maintain the depth of your squat for all the reps. Okay, so now when I'm ready to add weight, I can either put more weight in the backpack or I can pop 2 dumbbells on my shoulders. So let me grab those. So I've got a couple of light dumbbells, and I can put those on my shoulders kind of toward the back and start adding resistance. And then you could just do that without the backpack too. Either way works great. And you're just trying to add more and more resistance as you go along. And then once you get to about 30 or 40 pounds in your pack, you shouldn't put any more weight in the backpack. It's not really designed to carry that much weight. And then you're going to switch over to your barbell. Once you can do 30 or 40 pounds in the backpack, you will love the barbell. It's so much more comfortable than doing it with a backpack. When you take the backpack off, you're going to sit down, let it come off, and then, right? So it's supported. You can easily get it off. But if you try to do it that way to get it on, it's like you have to arch your back and then throw yourself forward to get it on and twist your spine. So I don't recommend that you put it on that way. So make sure you put it on like a counter height and put it on just like you would if you were hiking and you're out in the woods and you put your backpack on a rock and you have your lunch and then you put it back on, right? You don't want to put your backpack on the ground if possible. Okay. The only thing I didn't cover that I wanted to cover was how to add impact to our program, because that's the 4th sort of tier of adding vibration and impact to the bones. And so there's a quick little progression that I can do if you guys want to stay. You good? Okay. All right. So I want to use my dowel again. And I want to be on a soft surface, like either carpet or a yoga mat or a thick mat. It's just a little bit thicker than a yoga mat. And I'm going to bend my knees. I'm going to lift my heels. And I'm going to drop my heels down and progressively drop. And so it's kind of like I'm trying to do just a drop. And just see how that vibration feels through my body. Because you will feel it all the way up your spine to your head. So you want to be in the right posture and then drop those heels down. If you feel good about that, you're going to step off the mat and go onto the hard floor. And so you'll hear the thud. a little bit more. I still got the dowel in my hand, and I'm dropping. Okay. Then I can pick the dowel up, and you'll notice a lot more vibration because the dowel actually absorbs some of the vibration. If you have thick rubber shoes on, that also absorbs a lot of vibration. You want shoes on, but you want shoes that aren't too soft. Like Hoka shoes might not be the best to do this in. You want to make sure that you're getting some vibration. So a thicker sole shoe is not the best. You want a thinner sole, not so cushy shoe is best. Okay, then once you figure if that's okay, we're going to stand on the soft surface again, put the dowel down, and then we're going to do a little hop, and just a tiny little hop. And Tucker showed that 10 hops every day was really helpful for building bone density. Okay? And then if that feels good, then you can step onto the hard floor and try it there. And then try it with the dowel lifted and see how that feels. Make sure nothing's hurting and it doesn't feel uncomfortable or frightening. Okay? Then you're going to do single leg. And we're going to go dowel down, single leg. You'll want the dowel at first because you don't want to twist your ankle or your knee as you do it. And then once you feel comfortable with that, you do your 10 hops on single leg. So you'll do 10 hops with 2 feet, 10 hops with 1, 10 hops with the other, single. And then you progress to a stair. And so I have this step bench that I'll show you that is inspired by Christine Snow's work. It has these risers on it. So this is 4 inches by itself, and this is how it comes originally. Then you add the 2-inch riser and then the additional 2-inch riser to make it 8 inches altogether once you're ready. So you start with the 4 inches and then you progress upward to 8 inches. Same sort of sequencing. You're going to stand on the step and you're going to step forward 1 foot at a time and then step up and then step down 1 foot at a time. And do 10 times on each side. If that feels good, then you can try little hop.
Sherri, can you move the box back a little bit?
Yes, I have a mat here. I'm going to move that.
Great, thank you.
Dowel down and then hopping. So again, 1 foot at a time, then, and making sure that you step back up and be careful about that, so that your knee is staying in line with your foot. And then you do the other leg coming up. So that's actually beneficial for your knee as well. And then eventually you're picking up the dowel, doing the whole sequence. So by the time you've done the whole sequence, I always start with a built-in warm-up to make sure you're honoring your body, because every day is not the same. If you have arthritis, if you have some injuries, some days are good, some days not so good, right? Wake up, oh, my knee hurt today, you know? So maybe that's not the day you want to do the jumping. But you could try it by doing the built-in warm-up, see how my knee feels when I'm doing my heel drop, right? Then see how it feels to do the hop. Because sometimes it actually activates some muscles around the knee, and it could be the best thing you've done for your knee. And so you don't want to just completely avoid exercise and strengthening. So if you're not ready to do the jumping, you can prepare for it by doing single leg heel raises. I love those. You can do the tree pose from yoga. That's wonderful. You can use the dowel and try to pick it up as you go along and build your strength gradually. Okay, so I think I've been able to cover most of what I wanted to cover today. There's always lots more to do, but you have the 4 main exercises that are going to be helpful for building bone. And if you're doing it in your own home, you don't have a gym available, this is probably the best bet. So it's going to be your deadlift, your overhead press, your back squat, and your impact or jumping. So does anybody have a question? Are there more questions that came in that we didn't see?
There were a couple of questions that came in. First of all, before we go, how will people be able to reach you, and how do you work with people privately in a group? How does that work?
We do. I do group classes. We have a group class every day. I personally teach on Tuesdays and Thursdays, the advanced strength training group, and that's at 12 p.m. Central Time. And then the Friday, 10:30 a.m. Central Time, is a beginner strength training group. And we go through a lot of the hip hinge and the basics with people. And it's a very small class, usually all on Zoom. And then I have individual appointments available to do Zoom calls with you guys. And if you happen to be local, I don't know if anybody here is from Louisiana, but you can go to therapilates.com. I just put that in the chat. It's www.therapilates.com. And you can click register for classes, or that'll also take you to the appointment area. But probably the best thing to do is email me at sherri@therapilates.com and let me know that you want a consultation, or just tell me what you want. And maybe I can, suggest what I could offer to you.
Great.
Depending on whether you want a group experience or do you want a private instruction. If you have some injuries and you're dealing with that, I do physical therapy for that. And I do provide consultations and evaluations via Zoom for that too.
This just occurred to me. Do you take insurance?
No, I don't take any insurance right now. I am a Medicare provider, but I'm so full on Medicare patients right now. I have probably a waiting list of 25 people that want to bill Medicare.
Right.
So,
Okay. So a couple questions. What about a mini trampoline?
Great question. There is a study that was conducted in 2015 by POSH, P-O-S-H-C-H. Let me just put that in here, P-O-S-C-H. 2015. They did, get this, they did a 45 to 60 minute trampoline session designed to build bone and work on leg strength on the trampoline 3 times a week. And they got about 1% in bone density increase in the femoral neck. And that's the only study I've ever seen that showed results, but you have to do 45 minutes on a mini tramp. So I think that's a big commitment.
Big commitment, and trampoline is feels like it's more from the lymphatic point of view, that it gets the oxygen flowing, gets you moving around. Okay. So question, any accommodations for people who have hypermobility, EDS/H, in their wrists?
I can't say enough about strength training. Oh, I'm sorry, in the wrist.
In the wrists, and have to be able to switch when repetition gets too straining, maybe elbow or forearm or assertive braces, or assistive braces, excuse me.
Okay. Are they saying what to do about that, or?
Any accommodations for people? Yes.
Well, I would say the position that you lift in is super important. So doing like TheraBand flies, bicep curls. It's like a lot of times I'll see people that say they have wrist pain and they're doing their bicep curl like this, right? So I want it like that. I want it like that, not like that or like that. I don't want you to hang back on your wrist. I want you to put your wrist in that neutral position and do all of your exercises with perfect wrist alignment, the best you can do, palm down, palm up. Really be mindful about how you're holding your wrist. And then there's a couple of wonderful things I love for weight bearing. I think somebody asked about that. This wedge here is so nice for weight bearing, and that can give you a little bit of a slope downward if that's painful to your wrist. And the other thing is, when you're in weight bearing, do you see how my elbow's locked there?
Yeah.
That puts more stress through the wrist and is really painful to a lot of people. And if you just slightly bend your elbow and put your elbows in more of a parenthesis shape, that helps to unload the wrist a lot. And it actually activates the rotator cuff. So not locking your elbows in weight bearing is one of the biggest cues I think is helpful.
Okay. And do you sell DVDs?
I'm kind of phasing that out, but I do have some left for sale. You can look on the sherripilates.com website and see what I have available. Probably the one that most matches what we did today would be the Pilates mat for bone building and injuries. It's a good preparation for doing the strength training, but I do not have a DVD that has this program on it, just to let you know.
Is there a particular brand of bar that you use?
I get the one from Amazon that is only about $45. And it is they have different brands. So I don't really have a specific brand necessarily, but the one from Amazon that you can get for free, I'm going to send it to you in the little chat here. Let me get that.
Okay. And as you're doing that, Belinda Beck's program called Onero, is that how you pronounce it? Yeah. And that's what you do recommend, that program.
Oh, yeah. Yes, absolutely.
She's doing incredible work as you are.
She is, yes. Okay. So let me, for some reason, let me go here to find it. It's not on my list is not coming up. Okay. Find that barbell.
And is jogging beneficial for bones?
In combination with other things, it might be, but on its own, no. Hasn't been shown to have much effect on building bone. It is a high impact type exercise, and done in moderation, it may have some impact on bone, but it's not going to be as effective as the strength training program.
Where in Louisiana? Is it Monroe, Louisiana?
Monroe.
Yeah, Monroe, Louisiana.
Okay, I just put in a barbell that I use. It's the same one that I just used today. It's a 5-foot, 25-pound barbell. It's a great one for women to start with because it's not super heavy and it doesn't take up a lot of space. You don't want a 7-foot barbell. Those are not necessary. You don't really need that.
So Beth had a rotator cuff surgery 3 years ago and was told never to lift above her shoulder. How about the overhead?
That is a huge mistake and myth that unfortunately people, get that question or get that recommendation a lot. And what they mean is while it's healing, you don't lift above your shoulder or you don't lift if it's painful. But what you need to do is learn how to lift properly, and doing things like the preparation exercises where you use your TheraBand and you get your rotator cuff to get that shoulder centered in the socket. And then amazingly, when people get the shoulder better in the socket, then they can lift overhead. If you don't lift overhead, you're going to end up losing thoracic extension mobility, and lifting overhead is so important for improving our posture and keeping our posture and our spine mobile, because part of the act of moving arms overhead comes from thoracic extension. If you're rounded like this is how far you can go overhead, right? The rest of it comes from your thoracic spine. So if you limit lifting overhead, it is going to be detrimental to your spine in the future. So I suggest that you work with a physical therapist that will actually do one-on-one hands-on attention. And whether or not it's through Zoom or through hands-on in the room, definitely personalized attention to help you with the mechanics of how to lift your arm properly so that you're not doing this, that you're sinking that head of that humerus into the socket as you lift. And it's I can't even tell you how many people have been able to start doing it overhead by just doing the band and lifting overhead. That is actually wonderful for using the TheraBand, because you're activating those muscles that are going to pull that head out of that impingement position. Because it's really a biomechanical error. That's the issue, is, learning how to do it in better alignment is going to really enhance your chances of being able to lift overhead without pain. And you also can start on your back doing, overhead reach on your back. So you have gravity assisting you, improving your mobility and working on your range of motion in a pain-free environment.
The last question, and there are many. Okay. What about those with mild scoliosis and flat back syndrome?
Well, with scoliosis and, the flat back, you don't have as much compression, forward on the vertebral body. But I always recommend that people get a chin-up bar if you have scoliosis. And I think everybody needs one anyway to do the stretches overhead. And I'll turn my camera around because I have my Pilates studio on the other side here. My PT clinic is over here. And this is all my equipment here, the Pilates equipment. But up here, I have my bar that's attached to my trapeze table. So if I were to do, I've got a little stool here because I have all my patients do these stretches overhead. I'm going to stand on the stool and then reach up overhead like that. And then start to do some little shrugs. Now my feet are on the ground and I'm just lifting up onto my toes, doing some stretches overhead. And interestingly, this is also really helpful for impingement in the shoulder if you have shoulder pain. So shoulder shrugs up and down like that, and then stretching and lengthening and kicking one leg out to the side to help lengthen that concave side of the scoliotic spine. And then thinking of breathing into that side, maintaining that axial elongation, just like you would if you were doing something to improve thoracic extension if you were a kyphotic posture person. So,
okay.
So that lengthening and that axial elongation is what I want to see.
Hetty snuck in a little late question. What about the 8-pound bar? I don't know exactly what she means by that.
Yeah, the 8-pound bar is the one that by Yes for All. And I'll show you the brand name on there. If you enter Yes for All 8-pound weighted bar on Amazon, you'd be able to find it. And it costs about $35, I think.
Oh, okay.
Here it is.
Right.
Yes for All is the brand. And you're looking for the 8-pound bar. And somebody just ordered it last week. I always check to see if any of my products are available on Amazon, that Prime Day thing. And they had a few things. The barbells were maybe $4 discounted. This was a little bit discounted, but nothing was like miraculously discounted.
Okay.
You always want to check on the shipping costs for things, though, to make sure that you're adding up the shipping costs when you order something, because these barbell equipment, sometimes they'll sneak in that shipping cost on you. So be sure you're looking at that before you press pay, purchase.
So again, the group classes on Tuesdays and Thursdays are advanced. Those are 12 p.m. Central Time. And then the beginner class that you teach is at what time?
It's at 10:30 a.m. Central Time.
Okay. And what day?
Friday.
Great. Okay. Sherri, this has been absolutely fabulous. Your energy is wonderful. It's contagious. I think we had a wonderful turnout here and can't thank you enough. So I will end the call and thank you everyone for joining us.
Thank you so much, everybody. Happy bone building. I hope you got something that you want to get started doing right away.
Yeah. Lots and lots of compliments. Okay. Thank you. Okay.
Thank you.
Bye, Sherri.